right, so I guess, am I captaining this vessel with these astronauts here? I guess we could say that. So you all have met Doug. My name is Ernesto Ramirez. I'm just going to be moderating this panel. You don't need to know anything about me. I'm honored to be here, and I'm really excited for what we can share in this next 30 minutes. And we'll try and keep it to 30 minutes because I know lunch is directly after this, and if you're like me, your stomach is probably rumbling as well. So we met Doug already, so I'm going to hold off for you sharing your story, but I'd like to have both Britt and Sarah introduce themselves and their self-tracking story. So Britt, let's get started with you.
Okay, well, that was a deep quote on my blog. I'm impressed. But it's very much true, and for me, the problem is well, we'll start from the beginning. So I have two forms of autoimmune arthritis, undifferentiated spondyloarthropathy. Shout out to the spondylitis community online. So, which is a fancy way of saying that I have arthritis of the spine, as well as rheumatoid arthritis and chronic complex migraines. So a lot of chronic pain that I deal with. So that will be the standpoint and kind of my view here today. Quite frankly, I'm at a place where I don't think self-tracking is beneficial to me, and I would echo a lot of what Kyra said in her talk, is that the psychology of self-tracking has not been addressed appropriately enough. And for me, that guilt that she talked about is very, very much present when I've attempted to self-track, and that the apps that have been created around, say, chronic pain or my disease communities, I haven't found it to be effective for me, directly linked to my disease. Whereas I am able to find self-tracking that is focused on better wellness, whether that be my diet, my exercise, that sets up goals for me. That's where I find it successful, but I don't find an intersection of self-tracking with my disease directly. So I'm going to be kind of, I think, counter to Doug's really awesome self-tracking here in some of his charts. So that's kind of my backstory with it.
Great. Thank you for sharing. Sarah.
Yeah, so I have Parkinson's disease. I was pleased to be here last year and presenting about that. And as you can see, I have a problem with my gait. It's called freezing of gait. It's to do with how I use basically how I lift my knees and how I use my body. And I track a lot of things. Everything in Parkinson's starts with medication. And I try to keep track of my movements and in different ways, both my gait and my finger tapping to see how agile I am. But also balance, which is important. And I also went for a week of neurorehabilitation only 1 week ago, which started something, but it sort of didn't close the job. So I need to work on that, of course, obviously. But I also track my sleep, and so Parkinson's is a very complex disease, as you can hear, and mood as well. And well, basically, it's to do with everything that you want to do. So it's I've had lots of help from self-tracking, but it's also a challenge with access to data that Gary addressed and also Doug did, and also the integration of data from different sources is a big issue. So and the medical world definitely doesn't do it. So we need to do it for ourselves.
So I like the fact that all three of you represent kind of different strata of the self-tracking experience, whether it's really in depth, whether it's imposed by yourself or by others or by the condition that you're dealing with. I wonder if each of you might want to speak a little bit to what self-tracking does or doesn't do in terms of helping you make sense, making sense of yourself, making sense of your condition, the interaction between those two things. Doug, let's start with you, since obviously you've spent a lot of time with this sense-making question.
Right. Well, I think a lot of the self-tracking that I do is part of the reason is that I've been diabetic so long. I mean, after 28 years, I was diagnosed at 12, and during high school I wasn't thinking like this, and even up until probably my mid-20s, my control wasn't as good. But you hit certain points in your life and you decide that you're not feeling as good as you should, and that you want to feel better, and that if certain things help you feel better, and you start to connect those dots, then you're going to do these things. I had a moment like that with a doctor when I switched doctors, and my A1Cs were much higher, and he said, you know, if you keep this up, you're going to have a lot of problems later in life. And it's like, well, that message hits home. And it's also just, I obviously like the challenge of it in the data side, but also the creative side. I mean, I'm obviously a visual thinker about all these things, and it just frustrates me to see all these designs that are just, could be so much better. And so my project was sort of a, you know, combines all those different threads.
And it's a wonderful project. I really do encourage you all to check out Databetes, and I believe it's the actual post is called My Year in Data.
I call it the healthiest year of my life.
The healthiest year of my life. That's
Yeah.
correct. Yes. Brett.
So, you know, I think it's interesting since Doug's disease, you know, you very much numbers are imperative every single day for you. Whereas the only number that you can really assign to what I deal with is possibly the linear chronic pain scale, which is so subjective that there's questions about whether, you know, it even works. You know, do those smiley faces really represent? We were discussing this yesterday. Does it, you know, can children work with that? Can adults work with that? Is there something else it needs to be fixed? Just throwing that out there. But the problem is with those subjective numbers, if I track that, what does that mean for me? Because I'm going to read that data very differently than a researcher is going to read that, than my doctor is going to read that, because I can't follow it up with yes, but. You know, this is that number, yes, but this is what I was dealing with. And, you know, I'll throw it out there, and I tweeted this recently. I'm in a lot of pain today. You know, but nobody would know that because, you know, you walk around as a patient with your mask on. And the problem with tracking some of those subjective numbers is that there's so much emotion tied to that. And when dealing with chronic pain, sometimes my only barrier through getting through the day is not addressing it, not physically trying to assign it a number, not looking at it. So I don't need you know, a chronic pain app that's going to say, hey, what pain level are you in right now? And I go, well, thanks a lot, because I had somehow pushed that pain out of my mind. And then it's going to update me in 5 hours and say, hey, what pain level are you at now? You know, and going through that, that emotional kind of realization of, yes, I'm feeling pain. Let's stop and think about it, because in this moment, if I stop and think about pain, I feel it very differently than I did just 5 seconds ago. So trying to quantify that is actually more detrimental to me in my ability to cope throughout the day. Whereas I do have some success in the ability to help with, say, weight management, which is very important in dealing with rheumatic diseases, and my exercise goals. But those, to me, are two very separate things.
You know, we luckily had a chance to talk a little bit before a few weeks ago, and one of the things that struck me in our conversation was this difference between kind of the clinical outcomes, the outcomes that someone else designs for you that you would have to track, versus the quality of life outcomes that you're actually most interested in, both being related to what you have to deal with on a day-to-day basis. Can you speak a little bit more to kind of moving away from those clinical outcomes, like, you know, like those pain scales? You know, you talked to me about like apps that are asking you all these time, like, you know, random pings. It's like, okay, how do you feel right now? How do you feel right now? Where you're thinking of like, how do I feel in a larger, you know, a much longer time frame?
Mm-hmm. You know, I would say, you know, tracking is different to me. I look at different measures. You know, seeing your charts reminded me of painting that I've done, and I said this to Ernesto backstage, because, you know, you can look at some painting or art that I've done, and it's very dark at times, and other times it's much brighter. And to me, that's tracking my overall wellness in a much different way. You know, where I'm actually at with that. But the problem is, you know, with things that are being developed for me and not with me, we're not looking at the implications of what that means for me or what my goals are in using those tracking devices long term. You know, just trying to align my goals as a patient, you know, and that would be, hey, a cure, but, you know, we'll see if we ever get there. And then, you know, just being in less pain, or being able to say, get up and take a shower, go to the grocery store, and cook dinner that day. That would, you know, that would be a successful day. And I feel like those aren't the goals that are looked at in those apps. They are not aligned the same with what the patient actually needs. And therefore, who is that benefiting? You know, is it benefiting me really to throw in that data in there about my long-term goals? when I may track, and I've tracked plenty via paper, via apps for, as short as a week to months at a time. But ultimately, I find that I don't really gain much out of it when I'm actually looking at quantifying that pain or that disease, because ultimately my disease is random and ultimately can't be quantified. And that randomness is not taken into account, and so can really set me up for failure emotionally and psychologically, I think.
And I really like this concept you're bringing. We've heard it actually in, I think, every single panel, which is bringing this patient into the conversation. Like we've heard it actually for the last few years here at MedX and at other conferences and other communications, both online and offline. Using the knowledge and the skills and the needs of the patients to design and communicate what really needs to be going on in our tools and services. And I think that's a great transition to Sara and your experience, because Sara, you're a researcher, you're a PhD student, you're an engineer, but you also have started developing some of your own tools to track your own condition and some of the things associated with that. Can you tell us a little bit more?
Sure. First, just a comment on the medical scales. So in Sweden, there's a lot of talk about PROMs, patient-reported outcome measures. And that's, to my mind, is the patient's responses to healthcare questions. Whereas I think the useful thing would be to have the patients responding to his or her own questions. But going back to the tools then, so I was looking out for apps and devices and things that I felt the need for. And I couldn't find the ones I needed. They didn't have the functionality I needed myself. So I figured I had to sort out myself and try and get a team together to build them. So we are now developing an app for medication tracking iteratively together with patients, of course, not only me, but also other patients. So to make it useful for as many use cases as possible in the area we want to be in. But also, I don't see myself. People ask me, so what do you track? And I don't track much continuously. Only the ones that capture data passively or actively, they collect the data actively actually, so that I don't have to do anything, because if I'm doing well, I just want to get on with life. So I don't see myself as, I don't think it's necessary. I do tracking when I feel a need for checking things.
So we have about 15 or so minutes left, and I know there are a lot of ePatients here in the community, and I wanted to open up just for a little bit of time, and I had some email communication with a few of you, to hear a few more of these self-tracking stories that are here and present that I think deserve to be heard, rather than just focusing on these three wonderful people, which they deserve their focus. We talked a little bit before. We have some microphones here, so if we want to get up and use the microphones, perfect. And if there's other individuals that have a self-tracking story they'd like to share, please, feel free to stand up. We have microphones all the way back. I think there's 6 or 7 of them back there.
Hi, so I'm Carly Medosh. My Twitter handle is CarlyRM, and we were emailing last night. So I have been using a lot of different tracking options, and the first one I started with was one called Chronically, and it was started by Sean Ahrens, who has Crohn's and has been here in the past. And the one thing I like about that is it's not passive, but it's as close to passive as you could probably get, and still have to, input something. But it actually sends a SMS text message, and you can respond back with a number, and it's on a scale of 0 to 100. And it's very easy and not disruptive. You don't have to log into something. You don't have to remember your password. You don't have to wait for a web page to load and whatever. So that's really great. But one of the issues I have out of many, so I don't know how if you guys want to eat lunch today or not, but is that one thing, the scale of 1 to 100, I would put in, I'm not having that good of a day, 75, and I'm feeling a little bit better, 80. And I was told, years later, that they had designed it with, anything over, 60 or 75 as being really, really darn good. And I was like, oh, so if I gave that printout to a doctor, they'd be like, you're cured, it's amazing. And I would be like, oh God, I want to die. So, there's that, which, you guys have all kind of spoken to. And then the other issue is that I have not found a doctor that is interested in using that information. And You can get it in any kind of beautiful graphic format that you want, or interacting with their EHR, or whatever, those technical issues are. But if they don't know how to use it, how is that helpful? And then I'm friends with a lot of people with diabetes, and they have access to, test their blood sugar constantly. And I would love to be able to get information on my inflammation levels and my vitamin D levels and, B12 and iron and things like that, so that I can have a little bit more information as, why do I feel worse today than I did yesterday versus the day before versus tomorrow? Because so much of it is just, there's so many factors that I don't know how to use the information in a useful way. So it's very confusing and a little bit discouraging, but I have about 3 years worth of data. If anybody can solve this problem for me, I'd be happy to send you the file. So
Thank you for sharing, Carly.
You're welcome. Thank you, guys. Good job.
We have one more in the back, and then I do want to speak to one of the topics that Carly brought up that I think is going to be really important in this conversation.
Hi, my name is Erin Horton. My Twitter handle is @TheMeshWarrior. I'm interested, Britt, in the idea that you brought up when the notion of tracking chronic pain and the inadequate resources we have to quantify those things and not wanting to be reminded of it. And something that you said that very much caught my attention is this notion of beginning the day with what is going to define a successful or a good day for me, and quantifying that in a very subjective way, not like a data point day. So is it, I guess my question is it helpful to you as a chronic pain patient to wake up in the morning and have that as your first thought? What today will subjectively, goals, I guess, but tell me I've had a good day today and that I've managed and I've coped well and my quality of life is where I have the expectation it will be, even knowing my chronic issue isn't going to disappear.
I would say, and we talked about this a little bit, focusing on those goals and that quality of life is much more effective for me. And when I've been much more successful at self-tracking, it's been focusing on that. How was my day? If I'm going to rate it, and it was a very simple scale, 1 to 3. 1, bad. 2, 3, great. I don't need tons of numbers. Too much variable I think can be bad as well, because that can be overwhelming for the patient. But when I'm looking at that as far as my goals for the day, whether it was just getting through my day, whether it was working towards life goals as me as a person and not a patient or not as my disease, then that's really helpful. So I think it's realigning that and not couching it in the terms of chronic pain and so forth, because we manifest it in such different ways. Whether that's I was able to get out of my house today, whether I was able to communicate with people, whether I didn't yell at my husband, sorry, Jake, things like that. How did that pain actually affect my life that day? So there's a way to look at it that doesn't psychologically kind of trigger the patient as well. And I think that's the trouble with the apps that have been presented at me, where I'm asked to just beta test them, and then input isn't absorbed into that in the end. So it's looking at what the patient needs, and language is so very important in our psyche and our ability to cope. That has to be taken into account with these things. And then my quote that I wanted to throw out there from a great discussion with Haley Goldbach, who some of you will see around here yesterday, and we were talking about this, equating it to chronic pain. She said, well, you wouldn't ask an anorexic to constantly weigh yourself, would you? And that's how it feels living with chronic pain, is that focusing on this gives me this ideation on my problem and not where I can be positively as a patient and not where I can hopefully get as a person too.
So could I want to wrap it up in maybe like a sentence, which is hard for me to do, but is it helpful for you to start your day with some subjective measure of activities or whatever, if it's painting or taking a shower or leaving the house or not yelling at your husband, whatever it is it helpful to wake up in the morning and have a set of experiences to choose from and think this will define a good day, and then measure that for yourself in the evening or on a weekly basis or a monthly, whatever you...
I wouldn't say starting the day. I would say at the end of the day, definitely. The problem is when I wake up in the morning, did I need Percocet to get out of bed this morning? The answer is yes. You know, how long is that fatigue going to last for me today? How long is that chronic pain? And I don't know when I wake up. So sometimes trying to set those goals is overwhelming in and of itself for the day. So I have to take measure and stock of where I am emotionally, physically, with my body, and try to attempt. But the thing is, at least I think the important thing there is maybe to start by trying. Not setting goals, but just the, you know, I'm going to get up and try today.
Right.
And at the end of the day, then taking stock of, you know, I tried, was that enough? Yes, trying in and of itself was enough. Was I able to complete these other things?
So at the end of the day, having an answer that's not so binary, yes or no, but hey, pretty well, whatever gray area there is at the end of the day, is encouraging to you as a chronic pain patient in a way to self-track. Would that be correct?
Yes, I would say more so. It has been more encouraging to look at it that way, but it can also backfire.
Right.
So that's the problem.
The best of the worst.
Exactly. So if I see multiple days of you've been sucking as a person, you know, then that's really defeating for me, you know. And what is it going to take me to get out of that rhythm, you know? And that's when I stop self-tracking, because I don't want to look at that anymore.
Right.
And I just want to move on to being a person.
And it triggers pain.
Exactly. And I just want to move on and try to live some iota of life out of that and not focus on the self-tracking.
Okay. Well, I'm a nobody, but I don't think you're a sucky person.
Thank you.
So I want to stay on this level of the emotional component of tracking for just a little bit. And I'm reminded of a talk that Susanna Fox, most of you know Susanna Fox and her great work, gave at our public health symposium. And she likened, and please Susanna, pipe up if I get this wrong, she likened self-tracking to holding up a mirror to yourself, and that when we ask people to self-track, and we being a large we, you know, the health community, that we sometimes are asking them to hold up a mirror to things that they may not be ready to reveal to you as someone in the health community, or even themselves. And I can definitely relate to like what Kyra was saying earlier, that, you know, I have my own why things scale, I have fluctuated in weight, and there have been times when I'm like, I'm not going to get on that thing because I don't want to know the actual real number. It's scary. It's like, you know, when you come back from vacation, you don't want to open your email box because you know what's waiting for you. So I wanted to actually ask you, Doug, if you've experienced any of this type of emotional reaction with the self-tracking that you go through. In my reading, and I'll point to some great stuff that Chris has pointed me to in terms of the diabetic community, that, you know, they say that, like, they look at people in QS and say, like, you are choosing to self-track. We have to self-track, and that requires some emotional component that isn't usually there.
No, it's totally true. I mean, we're definitely generating a lot of data. I have 3 devices, you know, 2 needles in my stomach every day, so hundreds of data points a day. You know, I think getting into the emotional side, I think being an engaged patient and actually wanting to know is huge. And I think that's one of the biggest design challenges as well. I just think there's just so many bad tools out there that I think patients start off wanting to be active and wanting to take this thing and get it under control, but different parts of the system just make that so difficult. And so I think that's what the We Are Not Waiting whole movement is about. It's just that, you know, we've been dealing with these things for so long, and it's either you guys put out better solutions or open up the data so that people who want to solve these very tricky problems let us do a better job. They're tricky design challenges. We know that for sure. The behavior change side of things is huge. So, you know, you can build a great app, but if someone doesn't open it, well, then what are you going to really, you know, how are you going to really help? So,
Sarah, it looked like you had something you wanted to add.
Yeah, so it's about finding self-tracking for yourself rather than for your doctor. Because, I mean, I don't tell my doctor everything I take or everything I do, because he could mind, and that would give me trouble. So I'm the only one interested in the whole picture, really. So I said once at the talk I gave that, well, patients we don't have to wait for evidence. If I hear my neighbor is testing aloe vera or coenzyme Q10 or something, I don't ask my doctor for permission. And then there was this scaringly young doctor in the audience saying, but if patients do that, we have to stop them. I was like, how are we going to do that?
So that's a really great segue into something that Carly brought up, which is that as patients, especially patients that are engaging in some sort of self-tracking, whether it's diabetes data, whether it's quality of life, that many times that physician-patient or healthcare provider-patient interaction, it's tricky. There's time and time again, I would see there's articles around, doctors don't want to see your X and X device data. They just want to help you. What have you experienced with your own data that you've collected on your own to bring into the physician's office? What have those conversations been like? Let's start with you, Sara.
So I'm lucky enough to have a very understanding and mature neurologist, I would say. He knows that I know more about Parkinson's research than he does. He tells me so. And he also knows that I'm the one who knows best what my state is like. So when I came to him with my tapping test data the first time I did it, he was very interested and had a good discussion with me on how to interpret and what they meant. So we have a very good working relationship. Unfortunately enough, he's going to retire soon, so I need to find a new one. But I'm looking, so...
Britt, have you shared any of your, not some of this maybe the diagnosis type of data, but this quality of life data that you keep mentioning?
I definitely have mentioned it to him, and the discussion usually ends up with, well, what did you see out of it? Well, it proved my disease is as random as I thought it was. And did we really gain anything out of it? The interesting thing, though, is what they're tracking is kind of like you're bringing in, these supplements and so forth that we try. They don't really care about that, though they are kind of, they're tracking it inadvertently because I've put it into my record. So every time I go in there, it now forces them to ask, are you still taking B12? Are you still taking lysine and all these things? But do they do anything with that? No. What they're concerned about is when I didn't report that I'm taking the same milligrams to the medicine, whoa, you changed your dosage on your own, or something along those lines, But if it's the other stuff, they don't really care, the stuff that's important to me, which is fascinating. But the best way to sort of track with my doctor was they didn't think I was told I should never run again. And, we're both runners. We've talked about this. So my doctor was saying, walk, don't run. Just encourage me, just walk. And I was saying, yeah, running really feels good. This is working for me kind of thing. And he still didn't believe it. So it wasn't until I brought him that first 5K medal that was a way of tracking to him to show him how far I had come in the previous months, what those medications were able to do for me, what those supplements were able to do for me. So I think there's different ways of tracking that we have to think of, the creative ways of that to kind of show that to our doctors. So how do we quantify those things in a way that are relevant to them?
Doug, that amazing poster that you showed us earlier, what's it like to walk into a physician's office with something like that? Or maybe the first question is, have you?
Well, I sent it to her and also several of the other endocrinologists at the clinic. And, she's always been encouraging and shared it with other people that she knew. She's been my doctor for 13, 14 years, and we have a very good relationship. She sees my A1C results, and she's pretty much, the rest of the meeting is pretty much, whatever you're doing, you're doing great. So I'm not about to tell you to mix something up. And, I can understand that. She sees so many patients, and to be quite honest, it's also always a little grounding for me to talk to her because she's a little skeptical of technology, and she sees thousands of patients, and that she sees patients get better for a couple months, but then she sees people slip back. And, from what she sees on the technology side, I think she sees the same frustrations that I do. The access, the control of the data is all just as important.
So in our last minute, I'm going to get this question off really quickly and we can go down the line. So self-tracking, the role of technology in our lives is, it's obviously not going away. If anything, it's going to explode. Like, who knows what Apple's going to release, next week. It could change everything, or it could change nothing. But what are your hopes in terms of self-tracking in your lives for the next 5, 10 years? What are your hopes for the future?
So I want to share the feeling I had when I came back to Sweden from Quantified Self Europe conference in May. I said to my husband, that conference is fantastic. I don't feel sick there. Because nobody judges, nobody evaluates. In medicine, there's good and bad, there's high and low, there's right and wrong. But in Quantified Self communities, everybody's a Quantified Self experimenter. And that you get the respect for that rather than for what disease you have or not. So for me, technology is a tool, but it's only the tool. The most important thing is the knowledge you can make from using them. And that can be enhanced by using technology.
I would say I'd want to see the respect of the mind-body connection in disease and how that translates to technology and where that can actually help patients move forward. We're not just data points, we're stories, we're people. And every number, has a story behind it. It has a yes, but. So how do we incorporate those yes, buts and make that anecdotal evidence something that we can look at and that meets the goals of the patients, not the goals of pharma or my doctor or anybody else or my family or anybody. It's what I need as a person moving forward. So.
Yeah, I just want to see the technology become easier, a lot more passive data aggregation, and so you don't have to do as much. I mean, the rest of our devices and our software on the consumer side is so easy to use, so well done. I want to see that same thing applied to healthcare and be able to get better feedback. I think that feedback is what we need in between clinic visits to just stay healthy.
Great. Well, thank you all for sharing your stories with us today. We really appreciate it. And thank you also to Gary Wolf and Kara Baumanet for sharing their thoughts earlier in the session. And I think with that, it's lunchtime, right? All right. Thank you again, guys.